Dear chairs, esteemed colleagues, and distinguished participants, have a good one for you. Welcome to my presentation. My name is Dr. Çiğdem Dilek Harit. Today, I am honored to present our research title, From Individual Innovativeness to Medical Artificial Intelligence Readiness, the serial mediating roles of cognitive flexibility and attitudes toward artificial intelligence among nursing students, which was conducted under the supervision of my advisor, Professor Dr. Sevda Küçük from Atatürk University, and our other co-author is ASIC Prof. Esin Kavuran from Atatürk University. Without further ado, let's move on to the background of our study. Here is the outline of today's presentation. I will start with the background of the study, followed by our research aim and conceptual model. Then I will explain the method and the measurement tools we utilized. After presenting our key findings and the analysis of indirect effects, I will conclude with the theoretical and practical implications of our results. Now let's begin with the background. As we know, nursing education plays a vital role in equipping students with necessary clinical skills. Today, the integration of artificial intelligence is transforming healthcare by improving clinical decision-making and patient care. Therefore, it is crucial to develop AI competencies among nursing students so they can effectively leverage these innovations in clinical practice. Furthermore, effective AI adoption in clinical settings depends directly on students' medical AI readiness, combining technical skills with professional attitudes. To achieve this, healthcare professionals need an innovative mindset to stay open and adaptable to these rapidly evolving technologies. For innovativeness to translate into behavior, cognitive mechanisms play a primary role. Here, cognitive flexibility is key. It helps nursing students generate alternative solutions and cope with clinical stress. Ultimately, highly flexible nurses adapt better to emergency situations and help elevate stress for both patients and their families. Attitudes toward AI are a key factor in its adoption by healthcare professionals. Nursing students are more likely to accept and use AI in clinical practice when they view it as a supportive tool rather than a threat to professional autonomy. Previous studies have associated medical AI readiness with innovativeness, literacy, and attitudes. However, the mechanisms underlying this relationship remain unclear. Therefore, this study examines the serial mediating roles of cognitive flexibility and attitudes toward AI among nursing students. Based on this framework, we proposed four hypotheses. We expected individual innovativeness to predict medical AI readiness, both directly and indirectly, through cognitive flexibility, attitudes toward AI, and their serial mediation. This quantitative correlational study included 994 nursing students from a state university in eastern Turkey. The proposed relationships and serial mediation effects were tested using highest process macromodel 6. Ethical approval and scale permissions were obtained, and participation was voluntary. Data were collected in approximately 30 minutes, using for measures assessing individual innovativeness, cognitive flexibility, attitudes toward AI, and medical AI readiness. Following data screening and outlier removal, correlational and serial mediation analyses were conducted process model 6 with 500 bootstrap samples. Medical AI readiness was positively associated with all three variables, while the strongest relationship was between innovativeness and attitudes toward AI. Cognitive flexibility wasn't significantly related to innovativeness or attitudes toward AI. Individual innovativeness directly predicts medical AI readiness and strongly predicts attitudes toward cognitive flexibility, and attitudes also predict readiness. But the paths involving cognitive flexibility wasn't significant. The model confirmed significant direct effects of innovativeness, cognitive flexibility, and attitudes toward AI on medical AI readiness. However, the paths involving cognitive flexibility as a mediator weren't significant. Individual innovativeness had significant total direct and indirect effects on medical AI readiness. Model explained 10.3% of the variance in readiness. Only attitudes toward AI significantly mediated the relationship between individual innovativeness and medical AI readiness. The indirect effects through cognitive flexibility and the serial pathway weren't significant. In conclusion, it has been determined that attitude toward artificial intelligence serves as a significant mediating mechanism in the relationship between individual innovativeness and medical artificial intelligence readiness. Although cognitive flexibility didn't function within the serial mediation mechanisms, it made a direct and positive contribution to medical artificial intelligence readiness. These findings indicate that fostering students' individual innovativeness, cognitive flexibility, and positive attitudes toward artificial intelligence in nursing education could contribute to enhancing medical artificial intelligence readiness. They are our references. Thank you for attention.